Welcome to the network of Burn Healing Foundation, dedicated to providing reconstructive surgery and comprehensive care to underprivileged burn survivors. I, Aarti Ahuja, CEO of Burn Healing Foundation, welcome you to Champion of Burns, our flagship podcast series. Founded by our chairperson, Dr. Rajiv P. Ahuja, a distinguished plastic and burn surgeon for 4 decades with a global experience in the field. Dr. Ahuja's contribution to burn care extend far beyond from the operating room. As an academician, he has published extensively in peer-reviewed international journals and authored chapters in leading burn and plastic surgery textbooks. He currently serves on various editorial boards of several international journals and was honored with Lifetime Achievement Award from the International Society for Burn Injuries in 2022 for his exceptional contributions to the field and community. Dr. Ahuja has led numerous prestigious leadership positions, including the chairman of the Trust of Associations of Plastic Surgeons of India, chairman of International Society Burn Surgery Congress, past president of the International Society of Burn Injuries, founder president of Asia Pacific Burns Association, and ex-head of Department of Burns Plastic Surgery, Maxillofacial and Microvascular Surgery, Lok Nayak Hospital associated with Maulana Azad Medical College. Presently at Sir Ganga Ram Hospital, his vision and expertise have shaped burn care protocols and policies across Asia and beyond. At the Burn Healing Foundation, we believe that recovery encompasses not just medical treatment, but holistic support that addresses physical, emotional, and social dimensions of healing. Through this podcast series, we bring you the voices of our partner hospital doctors who are making comprehensive care possible. Surgeons pioneering reconstructive techniques addressing trauma and resilience, helping burn survivors rebuild their lives with courage and creating pathways to healing that might otherwise remain closed. Each episode further would be intended to explore the multifaceted world of burn care and rehabilitation in India, where access to specialized treatment remains a critical challenge. You'll hear stories of transformation, learn about innovative support to rehabilitation, and discover how collective action is creating sustainable change for burn survivors across our communities. This is more than a podcast about medical care. It is about the human spirit, the power of community, and the belief that every person deserves the opportunity to heal completely, mind, body, and spirit. Our anchor for our flagship podcast series is Dr. Viswa Chaitanya. He is a burns and plastic surgery surgeon trained at Kripa Medical College, specializing in acute burn, complex reconstruction, pediatric burns, and skin banking. He has presented national level research on skin allografting and advocated wound care practices. Currently serving at Grace Kenneth Hospital Foundation Hospital in Madurai, Tamil Nadu, and as our recent partner hospital in the BHF network. We welcome Dr. Chaitanya. He is committed to providing evidence-based reconstructive care that integrates clinical excellence, ethical tissue donation practices, community engagement, and global collaboration to enhance both functional and aesthetic outcomes for his patients. Along with Dr. Chaitanya, today our main guest is another actively contributing hospital partner of our BHF network, Dr. Selva SeethaRaman. Dr. Selva is a distinguished plastic and reconstructive surgeon with extensive expertise in oncological reconstruction, microsurgery, and hand transplantation. He currently serves as senior consultant at the Institute of Plastic Aesthetic, Burns, and Hand Transplantation at Gleneagles Health City, Chennai, and is director of the Dr. Selva Plastic Surgery Clinic. With over 2 decades of experience, Dr. Selva has achieved several groundbreaking milestones in Indian plastic surgery. He led the team that performed Tamil Nadu's first bilateral hand transplant in the private sector and harvested donor hands from Maharashtra's pioneering hand transplant procedure in 2020. His innovative work includes performing the world's first mandible reconstruction using a free vascularized fibula for a poliomyelitis affected limb. Dr. Selva holds multiple advanced qualifications, and recently he was elected as the secretary of the Association of Plastic Surgeons of India as well. And he's also equally published in various peer-reviewed articles, and even his articles find their voice in other people's researches as far as I could read about him. And that brings us to not only this aspect of his, but the more human aspect, his own work in philanthropy and in providing the holistic care to burn survivors. Trained in specialized microsurgery techniques in Japan and Taiwan, Dr. Selva specializes in so many numerous things and has taken academic leadership and also personal leadership to his commitment to make healthcare accessible through his Selva Sakhi Medical Educational and Charitable Trust, and keeps doing camps regularly for burn survivors as well. Once again, Dr. Selva, we welcome you along with Dr. Chaitanya. Dr. Chaitanya, you may take over now.
Namaste everyone. Welcome. Today we are honored to meet a surgeon whose compassion, leadership, academic influence, global microsurgical expertise, humanitarian service have defined the landscape of modern reconstruction and burn care in India. Dr. Selva SeethaRaman, sir. I want to share something personal as well. I had the privilege of being trained by sir at the Ethical Microsurgical Training Program at Chennai, and I have also opportunity to assist him in the operating room. Those moments were eye-opening, not just for technical skill, for the patient, humility, precision with which sir teaches and operates. So for me today, conversation is not just an interview. It is a chance to learn from someone who has inspired my journey in burn and reconstructive surgery. So thank you for so much joining, and it's truly honor, sir.
Thank you so much for your kind words, Dr. Aarti and Chaitanya. So we have a privilege and honor to be a part of BHF and being here as an invited guest for the podcast today. Thank you so much for the opportunity.
Okay. Sir, first I would like to start right from the beginning. What first drew you to the burn field and burn care and reconstructive surgery, sir?
See, I can explain this in two ways. On a larger scale, when I had my first camp as a camp in my village, I saw a lot of burns patients who are, and the way they presented, so much deformity, they don't know where to go or whom to operate or where to consult. So much of lacunae in the management. That's the first one. And more specifically, in the recent times, I had a child who, at that time, actually, when I went to the village, the first time I had a thing that something should be done for this. And on a very recently, I had a patient, a child, a 6-year child, who's, when they brought them, she's literally crawling. She's literally crawling for the last 6 months because of, lack of knowledge among the parents how to treat the child, and because so much of burn deformity, and she's not able to play with their peers. And I think probably in later part of the podcast, we might be able to show that video also. And that one attract, and exactly at that time, I had a connect with the DHF also. And we are able to treat the child who is able, and she is now able to play with their peers. I think that is the one life-changing moment I can say that brought me into this burn care and the DHF.
Excellent. Nice case. So you have traveled in some of the best countries in India, some best centers in India as well as across the world also. So who are the mentors and experience that shaped your approach to the burn reconstructive case?
See, here, if you want to be very honest, actually abroad, I've not seen that many burns, but India, I've seen a lot of burns. And specifically during my training, I've not got that much a mentor to treat about burn injuries who taught me. But practically speaking, the mentors are my patients, because they are the one who made me realize what burn is and what are the benefits of treating them. And in fact, we'll say no, actually, when doctors are like gods, I think when we treat a burns patient, you will realize that. I think they are the mentors who brought me into this field and able to continue this job so happily and with satisfaction.
So, when someone works so closely with the burns injuries, they often discover that the public and even medical professionals carry misconceptions, sir. What misconceptions did you have to overcome personally and professionally, sir?
So here again, when we see the burn injuries, first, as a patient comes with burns, our first aim, we always think to heal the wound and send back the patient successfully. I think that is our primary aim.
Yes.
But actually, if you see, the real treatment starts once the burn wound heals. I think this is the one, everything, even I initially misunderstood certain things. Suppose a burns of the hand, when we treat completely, we feel, yeah, the patient 100% all right, grafted 100% take and go home. But that is not the treatment aim. Actually, that is the area the treatment starts for rehabilitation. That point, I think that is a misconception, because most of the patients, though we heal the initial wound, the present later with so much of deformity, which gives much more greater problem for them to live in the society. So that is the one we should learn. And once that moment the wound heals, we should put them in a rehabilitation practice and make them back to their original work. Otherwise, again, just the treatment is just wound healing is a half done work. That's a misconception I came to overcome over the experience and by seeing so many patients.
Very well said, sir. Actually, even I have learned even after seeing so many patients only. Once the patient goes home and then comes back with the deformity, then the real stages start. Actually, treatment starts. Sir, at what point did you realize that our system had significant gaps in burn care and survivor support, sir?
So burn care, what I'm saying is, see, first thing is that when the initial burns happen at home, they don't know what to do at that point of time. So basically, initially we say pour water over it. When that sense they may not have. Usually still we have patients coming with paste, ink and batter on that, which actually adds infection, or applying ointment, in which case you will not be able to identify the depth of the burn. So the first thing is the initial primary care or the first aid, what they have to do at home. Sometimes it's good they don't do anything. Sometimes, and actually when they come, they do something bad, worse than what's going to happen. So that is one thing what happens. And second thing is there's no proper referral system, because burns as such initially it's just a clean wound and we have to take it the entire way in the same way till the wound heals. But if it is mismanaged at some point of time and the wound is infected, a superficial wound will become a deeper wound and they have a much bigger morbidity for the patient. So going to the right place. So the right first aid at home and they're going to the right place. And then follow up again. Any deformity, they should treat it early. So these are the things, the gaps which I realized, starting from home and reaching the hospital at the right place and the right specialist. I think that's the one, the gap is still missing. And whatever case which I'm seeing day-to-day practice, people are missing somewhere and come with a big deformity.
Sir, and do you feel like these organizations like burn healing foundations are addressing these gaps today, sir?
Of course. See, the thing is, they are, with the burn VHF for the last 1 year, what I feel is, say, they not only help the burn victims, actually they also promote awareness. I think this podcast is one of an apt instance of what they do. So it is actually they have a burn awareness of what to do. And the other important thing they do is they refer to the right specialist. All are board certified surgeons. So they are able to, it's not the just treating a patient. When we treat a patient, we always tell them that how we should treat it initially. We also educate the patient. And this words will spread among other patients also. And also they are having a lot of posters and other medias to, bring awareness to the patients.
So when someone chooses a mission-oriented path, there are always doubts and questions and challenges. What are the biggest challenges you faced, and how did your family, colleagues, and community react, especially when you have joined the Burn Healing Foundation, sir?
See, I think here I need to say, when the intention is good, like-minded people will join. I think I had the intention to do something good, and I think I brought it to the right platform under BHF. So it's nothing. I think since they are also in the right track, and when you want to do good, something automatically things will be shown, and you'll be joining there. No doubt about it. And actually, family members, if something good happens to the public or the patients, the family are really happy about it.
So as a doctors, we learn a lot from textbooks, but survivors often teach us deeper lessons. What have burn surgeons taught you that you have never learned in the medical school, sir?
First thing, if you say courage, burns patient brings a lot of valor and courage with it. Second, life is beyond beauty. And third thing is, the appearance may not equal what they're able to do. For example, you are seeing the Paralympics, everything. The people, they might not have a leg, might not have a hand, but still they're able to perform. Similarly, burns patient, just by the appearance, we cannot judge them with a book for its first page. I think that appears to a burns patient also. They can much more talented people are there, and and they bring a lot of courage, because when we treat a burns patient, they have to undergo multiple surgeries. They voluntarily come for the surgery next time. Every third month they come for a surgery, so with a smiling face. I think that much courage can never be learned anywhere. I think burns patient teaches us.
Yes, very rightly said, sir. Actually, the burns care is actually complex, but not just medically, but emotionally. What is the hardest part of your work that people outside the medical world may not fully understand, sir?
So I say, sorry, can you get me the question, please, again?
So what is the hardest part of the work that people outside the medical world may not understand fully?
Yeah, what I hear is the time we spend with the patients. I think the time bank, the amount of time, because see, money, charity, they're all things. Apart from that, when we say the amount of time we are going to put it, which is never, because the time and tide waits for none. They're going to put our time for this patient. I think that is the best thing people might not understand. When we do some charity work, it's not the money part, other thing, but the time, what's the spending with the patient is the most important thing I can say that I can give to the patient, which most of people don't understand.
Nice. So you have worked for many years in reconstruction and burn care. How has your approach evolved over time, and what are innovations, especially through the Burn Healing Foundation, excite you the most today?
See, here, if you say for burns, there is nothing called 1 + 1 = 2. We cannot have, each patient has a different type of burns and different type of deformities. So we have to literally use our mind. And I think a pure reconstructive surgeon or a plastic surgeon has to be, use entire knowledge to treat the patient. Because most of the other ones is just straightforward. But here you have to really use, and the most of creativity comes when you treat a burns patient. You see that in plastic surgery, there are different types of flaps described. You see that most of them have been described in burns.
Yeah.
Because this is the one a plastic surgeon can show his creativity. I think that's the one I learned from burns.
That truly surprised you while working with the survivors, sir? Especially with the burn survivors?
So the thing is, surprises me. I think the only thing, again, as I already mentioned, the positivity they have in it, because they already got. If you see, failure is not when you fall; it is when you fail to get up. That is the real failure. I think burns patients, they have a fall, but they come up nicely back to form, and every time they come with a smiling face for us to get it treated. I think that is the thing we learn from these patients. So the courage and the willpower things. I think that's one thing. I think every surgeon, the moment we start treating burn patients, I think we love to treat them. There's
same feeling, sir. Same feeling. I've started having it since last 4 years. So beyond the Burn Healing Foundation, you have led several academic and surgical initiatives. Which programs or projects are you the most proud of contributing to it, sir?
So, as Madam mentioned in my introduction, I have my own trust, like Selva Medical Trust, where I treat patients in my native village in Tiruchendur in the southernmost part of India. That is one. And apart, so where I do a free plastic surgical procedures. And last year we had a joint along with BHF and did a few burns patients also. Along with that, I'm associated with another Swiss-based NGO called GCAM, where they operate in a village in Jamket near Pune. So these are the two NGOs I'm currently associated with, apart from BHF.
Nice, sir. So in burn care, success cannot be measured only by surgical results. How do you personally measure the success of your philanthropic and humanitarian work, sir?
So here, if we say satisfaction, one word, satisfaction. A good sleep after treating the burns patient. That's it. As simple. Whatever patient we treat, when we treat a burns patient, really we are satisfied. and we are happy that we are able to do this because of in this profession we're able to serve many more patients. And it's also not only it's in burns,
Real
the
burn
treating,
specialist.
yeah, treating burns patient is not a one-way job, not we are treating. The patient also expresses the same with us, which may not be found in other specialty of plastic surgery. That's what I feel.
That's really same, sir. Sir, and this journey, what role has the burn impact?
I didn't get you.
So, what
Your
role
voice is
has the
breaking.
Burn Healing Foundation played in? Sir, am I audible, sir?
Yeah, please. It's slightly breaking. Yeah, tell me.
Yeah, sir. What role has the Burn Healing Foundation played in amplifying your impact, sir?
So first thing is they they are getting we are getting affiliated to the hospital in the association. They see the hospital with a proper facility only they get affiliated, and the proper surgeons. So similarly, I got affiliated to them, and they promote them through their uh, media channel like a website and awareness program. And this podcast is again another example how they promote us. That is one. And because of the DHF, we can, whatever patients now we see, we can boldly say them, yes, there is someone behind us who can support you. So I think that's the biggest thing. So because whenever the burns patient, there are three things. One, usually they are little from low economic status, and sometimes they will not be able to bring to a place. Suppose they will be little far away, they may not be able to come to a place where to get operated, the follow up, and so these gaps are nicely filled by BHFs. So they choose a proper hospital, they choose a proper surgeon, and also they pay for the surgery. Apart from that, they also sometimes go to the extent to spend money for the commutation also.
Yes, sir. Really, actually, Burns Healing Foundation is a really good platform for like burn surgeons like us, sir. Actually. Burns patient need actually medical care, counseling, social support, long-term rehabilitation. How do you balance all these dimensions together in your practice, sir?
This is one of the most difficult questions, if we honestly say. The reason is, while treating the burns patient initially, they become so much involved with their history because each patient will have their own history. Whether it's a homicidal or a suicidal or accidental, but become so emotional with them. But the moment of the more get involved, it's very difficult to treat them also because they will be like a family member when we speak to them. Because usually they'll be most of them will be a chronic patient, more than 20 days or 30 days will be in the hospital. But when we treat them, we have to little bit come out of that emotions. Then only we'll be able to treat them. Actually, initially it was a really difficult job to treat them. But over time we managed that, yes, this is a patient, this is them, and we are also able to confidently explain them. So this day you'll be like this, and then by this day you'll be all right, and this day we'll going home. Everything will be able to, and we'll be able to achieve this much result for you in this many days. Those things you're able to say much more confidently now, and we are a little bit outside that emotion circle to get them treated.
Yes, sir. So, what is your vision for burn care and survival recovery in India and globally, especially through Burn Healing Foundation, sir?
So first thing is we have to, there are a few gaps which I already mentioned. First, starting from the first aid and what they have to do at home. And then they should have, whichever hospital or the surgeons affiliated to them, they should also have equally apart from the surgery we perform, we try to create the awareness. We should have spend some time with the patient to create awareness about the burns to the attenders. What are the things can be treated and where to approach, again, which doctors should approach. Those things you should sell them. And apart from that, using all the possible digital platform also I think VHF is a much well organized NGO. They can do they can carry this to thousands of patients than an individual surgeon can do. Whatever they do exemplifies in a digital platform.
Rightly said, sir. Rightly said, sir. So, in a country as diverse as ours, access to care is often unequal. How can advanced burn and reconstructive services become more accessible across all socio-economic levels?
So here, see, we do the Instagram, WhatsApp, Facebook for putting our posters and this thing. I think this thing can be very constructively used for these type promoting these awareness. So whenever I have a camp, I always put that in my Facebook page rather than putting my picnic pictures. So with these platforms can be rightly used on. And this podcast again can be, this is the one thing which can be rightly used to create awareness. Apart from that, from equality, I need so now how we are doing a podcast from different places. Similarly, we can also have like a teleconsultation for a difficult case. A person who's good in burns or some difficult reconstructive strategies, he can consult a patient sitting in Kanyakumari. He can treat a patient, consult a patient in Jammu. So we can this teleconsultation again a mode which can make the access easy for these patients.
Maybe in future we may start doing such things, and
of course, and also distance
foundation team can help us doing such things also in future, sir. Hope we can continue such work beautifully also, sir. So for people watching this who are not medical professionals, how can they contribute to supporting these burn survivors, sir?
So because if you see that they are the much bigger numbers than burn, if you see the support which they can offer is much more than medical professional will do, because their numbers are huge. First thing is, don't do anything which is going to have a harm to the patient, because out of curiosity they just do something really harmful to the patient. I think that is the one thing which I want to say, because when a burns patient, if you see has some problem, burns at home, only the moment the neighbors come and do something wrong, I think that is because all the family members in the emotional state and this thing happens. So first thing is, don't do anything wrong thing. And second thing is, try to create who are in that area, create a community and create an awareness in the local area. I think that is the one, because how to treat and keep telling them when you learn something right, just next days, instead of just saying some about movie and this, that, speak something, pass on the message to the people, public, to a friend. What are things you have learned about burns and where are they treating? For example, this BHF is available. When you're able to hear that, then go and tell your friend. At least 5 friends you tell that there's something BHF is available, that they are doing good work, can refer to patients. And when you know how to treat a patient, burn first victim, when they have at home, what they have to do first. If you learn them, then just put it to across the next people. So also speak, don't, instead of speaking, whenever hear some good things or good news or a good message or a medically important message, also pass on these to people, not just a WhatsApp forward, just vocally tell them. I think that is the greatest impact these people can do for the public, and these things can reach a much larger scale in a long run.
Sir, I rightly said, sir, actually we should promote more of don'ts than do's, what has to be done for the patient. And people should also speak actually good things and should pass on the message as rightly mentioned by you, sir. And in their own communities, what simple actions can ordinary citizens can take make a real difference, sir?
I didn't get you.
What simple actions can ordinary citizens to make a real difference in their own communities about this burns cases, sir?
Yeah, so the thing is, see, basically any community will have one leader or some group head will be there. I think they should be little bit, I think we can choose those people and can teach them about the burns, what should be done. I think then the message will be spread very fast to the public, to reach the public. I think that's the way. And because they are much bigger numbers than a medical professional group altogether. So if you teach the group head or the community leader in each village how to treat a patient or how to refer a patient, and each one, so that this will bring the overall burns burden and the morbidity to a greater extent.
Yeah. So you have mentioned that you are the part of many of the NGOs like Burn Healing Foundation and Shakti Selva. So like that, we need to catch the heads of all the people in Taluka districts and everywhere.
Yeah. See, in every state, every district or every village, there will be some NGO, a lot of small NGOs are there, different types, but they can all be put together and keep on just telling them. And when you say by word of mouth spreads, just tell them, keep on telling repeatedly. I think these things, when they spread, I think this over a long time, over the next, this over a lot, over time, this will be spread. The news will be reaching much more. Because India is a much bigger country, these things will reach a larger people.
Yeah, nice. So if you have one power to change things about how society view the burn survivor, what would be that, sir?
Uh, don't judge the book from the first page. I think that's something I want to say, because burns of people may appear odd, but I think they have much more powerful person, and they have a much more vigor and valor they can do. I think that's the one thing I like to say. And about burns patient, even I had, when we first saw the patient, burns patient, in the first time when I met them, becomes really difficult the way. But once we start moving them, and when we treat them, and we when they're back to the society as a normal person, they work they can do. They'll be able to do the same work, sometimes better than many other people. I think that's the one thing they also. So never ever judge a burns patient by their appearance. I think they also have a heart. They are also a human being. Though their skin may appear odd, they are also a human being, and they are also a heart, and they also love behind.
Nicely said, nicely said. Sir, actually, what would you like to suggest to the younger doctors like us, like me, and to the joinees like medicos or trainees in plastic surgeons, about taking about burns as a profession in plastic surgery, sir?
I'm sure when you turn back, you'll be happy. That's what I can say in a single word.
Nice.
Turn back after doing it. Return back, you'll feel happy.
When I joined Keel Park Medical College during my post-graduation days, initially I was like tough time because I was seeing so many deaths in the births. But now when I turn back now, after every smile from the when patient goes home, like those are the memorable moments I still feel, sir. That has made me to passionate do more burns work, and now I am collaborated with the Burns Healing Foundation also. Sir.
Great.
So, what is the one message you wanted to give to every listener to take away from this conversation, sir?
So be careful and prevent burn injury, and go to the right place for your treatment, and BHS is with you if you have any problem.
Recently, sir, in Asia Pacific Burns Conference, I have met the Dr. Ahuja, sir. You know, he's the pioneer and he's the founder. He's the president of International Society of Burns Injury as well as the Asia Pacific Burns Injury. It was a privilege to meet him because he was a role model for every of the plastic surgeons in India. Sir. So, what was the experience with him, sir, when you met, and how helpful for you in your career as a mentee?
Yeah. So I have known Malaja sir for last few years. He's so meticulous, and I'm very happy that he chose me to be a part of PHF. It means it gives in a sense of achievement for him, because he's a person who chooses the best.
Yes.
And he wants to, whatever he does with perfection. Yes, I have been a part of that APSI, and he has been in all the meetings. So he does with so much perfection. And if he chooses you and me, then it indirectly mentions that we are good and we are here to perform for him. So it gives much more responsibility for us now to do better.
So after listening to this, I'm much more responsible. I'll do very good surgeries in future. I'm really thankful to the Burns Healing Foundation, sir. Actually, they have chosen us. Actually, instead of we choosing them, they have chosen us. We should say, sir. Actually, so before we close, we have a quick rapid fire, sir. Just first thing that comes to your mind, sir. One word to describe the burn survivors, sir.
So I don't want to call them survivor. I want to say this burn conqueror. They have conquered the burns.
Wow.
Burn conquerors.
Burn conquerors. Nice, nice. So best advice that you have ever received?
Sorry, 1 minute. Just 1 minute. Just go question once again. Okay. Yeah, can you repeat the question?
Yeah, so best advice that you have ever received while treating the burns patients?
Yeah, remuneration need not be money, but it can be in the form of patient satisfaction. I think that gives the best remuneration.
That is nice. What keeps you motivated on difficult days, sir?
So, a smile from a burns patient.
You hope for the next generation for the burn care professionals, sir?
BH is with you, so keep rocking.
Yeah. If you could thank one person who made your work possible, who would it be, sir?
My teachers.
So complete this sentence. Every burn survivor deserves.
the best quality of life like any other normal patient.
Nice, sir, nice. So you, after going through all this, your conversation, it was really eye-opening for me as well as for the viewers also. After seeing this podcast, so really, every burns patient teaches us every different lesson from each and every survivor. So it is not about sending the patient initial acute treatment. Once the patient comes back for the burn deformity, the real treatment starts there, as you mentioned rightly, sir. And Burns Healing Foundation has given us a very good platform to do the surgeries for all the patients who are having the deformities, all these things. Thank you so much, sir. Your journey, your insights, and your commitment to your patients reminds of all why burn care and reconstructive surgeries are not just medical specialties. They are missions for hope and humanity, sir. Today, you have not shared your knowledge, but also the values of your definitive work, precision, compassion, and consistency. For every young surgeons like us watching, including myself, your words are a reminder that skill matters, but purpose matters even more. On behalf of everyone here, thank you for your time, your guidance, your lifelong dedication to advancing reconstructive surgery in India, sir. It's my privilege to learn from you today. Just it has been privilege to learn from you inside the operating theatre. Thank you, sir. On behalf of Burn Healing Foundation as well as from the Grace Kenneth Hospital, Madurai. Thank you, sir.
Thank you all. But I think we should thank DHF for bringing all of us into a single platform, first of all. And they are doing a lot of work for the public, and this podcast is another example to make public aware of what they are doing and what the best that can be done to the public through this Burn Healing Foundation. And I thank the Burn Healing Foundation and Aarti Madam for giving me this wonderful opportunity and made me the first speaker in this podcast. And I'm sure that will be a great success and reach many more people. And also, I'd like to mention those who are hearing, we have the will and the talent to do, but it also doesn't stop with that. We need a lot of donors also. So thus, who are people who are hearing this, if we're able to donate. So I think that will be a great help to the BHF Foundation so that it can help many more people whom you may not be able to see, but still they may bless you from somewhere. Thank you so much.
Thank you, sir. Thank you, sir. Thanks for Burns Healing Foundation for giving me the opportunity to speak on behalf of.
Madam.
Thank you, both of you. Thank you, both of you. And now I will go towards the ending. Please stay on for the bit.
Yeah.
When we give cheerfully and accept gratefully, everyone is blessed. As Dr. Selva's words and his experience highlighted, when one door of happiness closes with a burn injury, another opens through doctors and professionals like himself and Dr. Chaitanya, giving to the community and working for all the patients. We all are blessed when we give with a joyful heart. The joyful hearts of Dr. Selva and Dr. Chaitanya have made our flagship podcast and our first episode a roaring success. The contribution of our back-end team, Mr. Shashank, and all the other hospitals partners in taking Dr. Ahuja's mission forwards make me, Aarti Ahuja, grateful each day. As Dr. Selva just reminded all of you, it's important that we not only receive your support on various social media platforms, but also in donations, because it is through the donations that we help our hospital partners in providing the surgical care. And by building a community around the surgical care, we hope that we can open new doors of giving people a restored life with a dignity and a quality of living well. Subscribe to our channels and push the notification button. Follow us on our social media platforms. And if you are willing to donate, our website is www.burnhealingfoundation.com. And once again, I thank Dr. Chaitanya and Dr. Selva for making this first podcast a lesson of courage, resilience, and as most burn care programs say, prevention is always better, along with persistence in care. Thank you so much.
Thank you.